People are dying younger than ever, and not from old age. In some countries, the average person won't even make it to 55. These aren't just numbers, they're lives cut short by war, disease, and poverty. In this video, we're counting down the 10 countries with the world's lowest life expectancy, and the heartbreaking reasons behind it. If you care about truth that doesn't make the headlines, hit that like button and subscribe for more. Number 10. Namibia. Towering dunes and rugged coastlines tell one story, but daily life tells another. This upper middle-income nation still struggles with deep-rooted inequality, a legacy of colonialism that shows itself most clearly in healthcare. Urban areas have access to decent medical facilities, while many rural communities go without even the basics. Though major progress has been made against HIV/AIDS, the disease still casts a long shadow. In the early 2000s, life expectancy fell below 50 years. Thanks to antiretroviral treatment and prevention programs, it has now risen to about 67 years, 71.5 for women and 63.5 for men. Yet, challenges remain. Around 13.3% of adults aged 15 to 49 still live with HIV, and stigma continues to stall prevention and treatment. A two-tiered healthcare system, public and private, means life-saving services like dialysis are often out of reach for the poor. Behind the breathtaking views lies a nation still working to close the gap between economic classification and the reality faced by its people every day. Number 9. Eswatini. Life expectancy in Eswatini has risen to approximately 64 years in 2025, a significant improvement from the early 2000s when it was below 50 years due to the HIV/AIDS crisis. Despite this progress, the country continues to grapple with one of the highest HIV prevalence rates globally, with about 25.9% of adults aged 15 to 49 living with the virus. Efforts to combat the epidemic have led to a remarkable 72% decrease in new infections since 2010 and a 55% reduction in AIDS-related deaths. The expansion of antiretroviral therapy, ART, has been pivotal, with 88.6% of HIV-positive adults achieving viral load suppression. However, recent cuts in international aid, particularly from the US, have strained the healthcare system, leading to drug shortages and challenges in maintaining treatment programs. These developments underscore the need for sustainable, locally driven healthcare solutions to ensure continued progress in the fight against HIV/AIDS and to further improve life expectancy in Eswatini. Number 8. Mali. Mali ranks among the countries with the lowest life expectancy globally, with an average of approximately 62 years as of 2025. This figure reflects persistent challenges in healthcare access, infectious disease control, and maternal and child health. Infant mortality remains high, at 58.9 deaths per 1,000 live births, and under 5 mortality stands at 90.6 per 1,000. Malaria, cholera, and meningitis are prevalent. Exacerbated by limited healthcare infrastructure, there are only 0.13 physicians per 1,000 people and 0.1 hospital beds per 1,000. Vaccination coverage is low, with only 45% of children receiving all basic immunizations, leaving many vulnerable to preventable diseases. Malnutrition affects nearly 22% of children under 5, contributing to developmental delays and increased mortality. While maternal mortality has decreased from 660 to 317 deaths per 100,000 live births. Since 2010, the overall health landscape remains fragile. Ongoing conflict and climate-related crises further strain the healthcare system, highlighting the urgent need for comprehensive interventions to improve health outcomes in Mali. Number 7. Somalia. In 2024, Somalia's life expectancy stood at approximately 59 years, reflecting a modest increase from previous years. This figure remains among the lowest globally, underscoring the nation's enduring health challenges. Decades of conflict have severely disrupted Somalia's healthcare infrastructure, leading to limited access to medical services and a shortage of trained professionals. Informal providers have emerged to fill this void, yet many communities, especially in rural areas, still lack adequate care. The 2021 to 2023 drought, the most severe in 4 decades, exacerbated these issues. Over 7.8 million people were affected, with more than 1 million displaced due to acute food and water shortages. In 2022 alone, an estimated 43,000 excess deaths were attributed to drought-related causes. Children are particularly vulnerable, with nearly 20% dying before the age of 5. Malnutrition, stunting, and diseases like pneumonia and diarrhea contribute significantly to these mortality rates. Projections suggest that by 2030, life expectancy may rise to 65.4 years for females and 58.5 years for males. However, achieving this requires substantial improvements in healthcare access, nutrition, and overall living conditions. Number 6. Guinea. Guinea's life expectancy has seen gradual improvement, reaching 58 years in 2023, up from 60.43 in 2022. Despite this progress, the country remains below the African average, ranking 188th globally. A significant contributor to this low life expectancy is the limited access to clean water and sanitation. As of 2020, only 58% of the population had access to improved sanitation facilities, with rural areas particularly underserved. This deficiency facilitates the spread of waterborne diseases such as cholera and typhoid fever. Healthcare infrastructure also poses challenges. With just 0.23 physicians per 1,000 people and a hospital bed density of 0.3 per 1,000, the system struggles to meet the population's needs. Moreover, the entire population is at risk of malaria, a leading cause of illness and death, especially among children under 5. While Guinea possesses abundant natural resources, systemic poverty and inadequate infrastructure hinder the nation's health outcomes. Addressing these issues is crucial for improving life expectancy and overall well-being. Number 5. Lesotho. Lesotho's rugged highlands, while breathtaking, pose significant challenges to healthcare access. The country's life expectancy stands at 58 years as of 2023, with women averaging 60.01 years and men 54.62 years. A major contributor to this low life expectancy is the high prevalence of HIV/AIDS. Approximately 270,000 people live with HIV in Lesotho, accounting for 19.3% of the adult population. In 2023 alone, there were 4,800 new HIV infections and 4,000 AIDS-related deaths. Despite these challenges, the country has made strides in treatment, with 240,000 individuals receiving antiretroviral therapy. Lesotho also faces the world's highest suicide rate at 87.5 per 100,000 people, highlighting the need for improved mental health services. Efforts to combat these issues include initiatives to prevent mother-to-child HIV transmission and improve healthcare infrastructure. However, the combination of geographical isolation and limited resources continues to hinder progress. Addressing these challenges is crucial for improving the nation's health outcomes. Number 4. South Sudan. The average life expectancy in South Sudan is approximately 57 years, with women living an average of 60.63 years and men 54.64 years. While this marks a slight improvement from previous years, the country remains among the lowest globally in terms of life expectancy. This disparity is influenced by several factors, including limited access to healthcare, inadequate sanitation, and ongoing conflicts that disrupt essential services. The maternal mortality rate is notably high, and many children face preventable diseases due to malnutrition and lack of medical resources. Efforts to address these challenges are ongoing, with initiatives aimed at improving healthcare infrastructure, providing nutrition support, and enhancing education. However, substantial progress is needed to ensure that all citizens have the opportunity to live longer, healthier lives. The situation underscores the importance of international support and sustainable development to address the root causes of health disparities in South Sudan. Number 3. Central African Republic. Life expectancy hovers at just 57 years, one of the lowest in the world. Women live slightly longer at 59.3 years, while men average 55.2. Decades of conflict and political instability have devastated essential infrastructure, especially in healthcare. Hospitals lack basic equipment, trained staff, and medicine, particularly outside urban areas. This fragile system struggles to contain widespread diseases like malaria, HIV/AIDS, and tuberculosis. Malnutrition only worsens the crisis. Over 40% of children under 5 are chronically malnourished, leading to stunted growth and weakened immune systems. The toll is heartbreaking. 67 out of every 1,000 infants die before their first birthday, and nearly 93 children don't live past the age of 5. These numbers point to a desperate need for comprehensive healthcare reform and sustained support. International aid remains vital, but without long-term commitment to rebuilding the nation's infrastructure and training its healthcare workforce, real progress will remain out of reach. A better future is possible, but only with consistent global engagement and local empowerment. Number 2. Nigeria. Accessing basic healthcare is a daily struggle for millions, especially in regions plagued by preventable diseases and weak infrastructure. In many areas, illnesses like malaria, tuberculosis, and HIV/AIDS remain widespread, while maternal and infant deaths continue to claim lives at an alarming rate. Medical facilities are often overwhelmed, understaffed, and underfunded, forcing patients to travel long distances or go without care altogether. One such nation, despite its massive population and regional influence, has seen little improvement in health outcomes over the years. Doctors are scarce, with fewer than one available per 1,000 people, and hospitals regularly face shortages of essential supplies. The government's healthcare spending consistently falls short of international benchmarks, leaving critical gaps in services. The results are stark. The average life expectancy stands at just 56 years, more than 18 years below the global average. For a country with immense potential and natural wealth, this statistic reveals a troubling disconnect between growth and well-being. Turning things around will require not just reforms, but a complete reimagining of the public health system. Number 1. Chad. Severe challenges plague this nation's health system, including a critical shortage of medical personnel and limited access to healthcare facilities. With just 0.04 physicians and 0.31 nurses or midwives per 1,000 people, many communities struggle to receive even basic medical care. High rates of infant and maternal mortality compound the difficulties, while widespread infectious diseases such as malaria and diarrheal illnesses remain major threats. Poverty, malnutrition, and insufficient access to clean water further worsen the public health crisis. Due to these overwhelming factors, the average life expectancy here is around 53 years, one of the lowest in the world. Women tend to live slightly longer, with an average of about 57 years, while men average closer to 53 years. This stark figure reflects decades of hardship and underinvestment in essential services. Meaningful improvements require urgent attention to healthcare infrastructure, education, and poverty reduction efforts to break this cycle and create a healthier future for all. In some parts of the world, life expectancy barely reaches 54 years, less than half the global average. Deadly diseases, lack of healthcare, and ongoing conflict steal precious years from millions. These aren't just numbers, they're real people facing unimaginable challenges every day. Don't forget to like and subscribe for more.